Hello everyone, today let's discuss about oral hygiene practices. These are the contents of our today's discussion, which includes oral hygiene, dental caries, plaque, calculus, plaque control, both chemical and mechanical, toothbrushes, brushing technique, dental phases, toothpaste, dental floss, interproximal cleaning, wooden tips. Starting with oral hygiene. According to WHO, hygiene, just hygiene, refers to a condition and practice that helps to maintain health and prevent the spread of diseases. Oral hygiene is also known as dental hygiene. So, oral hygiene is a process of maintaining proper dental care to avoid oral health problems because good oral hygiene prevents dental caries, plaque, and calculus. So we will be discussing about dental caries, plaque and calculus in a little detail, starting with dental caries. Dental caries is an irreversible and then microbial disease of calcified tissues of the teeth characterized by demineralization of inorganic portions and dissolution of the organic portion. Factors that lead to caries formation are these four. Number one, microorganisms, the agents. Number two, tooth, the host. Environmental factors like carbohydrate rich diet and saliva, and time period during which these three factors are together. Classification of caries. According to G.V. Black, caries are classified into 6 categories. Class 1 caries are seen in patent fissures of the occlusal surface of the posterior teeth, buccal and lingual grooves, and lingual pits of the anterior teeth, as seen in this diagram. Occlusal surface, patent fissures, occlusal surface of posterior and lingual surface of the anterior teeth. Class 2 caries are seen in the proximal surfaces of the posterior teeth, and class 3 caries are also seen in proximal surfaces but in case of anterior teeth without the involvement of the incisal edge. Class 4 caries are also seen in the proximal surface of the anterior teeth with the involvement of the incisal edge. Class 5 caries are seen in the gingival third of both anterior and posterior teeth. Class 6 caries are seen in the cuspal heights and incisal edges, that means here. Number 2 was plaque. So, plaque is defined as structured, resilient, yellow-grey substance that adheres tenaciously to the intraoral hard surfaces like teeth, which includes RPD and FPD if present. Calculus. Calculus is the mineralized form of the dental plaque, hence it is hard by nature. So, the calculus is the hard deposit that is formed by the mineralization of the dental plaque and is usually covered by a layer of mineralized plaque. So, this diagram shows the importance of plaque control. In the first diagram, you see that the teeth is in healthy condition along with the healthy gums, that is healthy gingiva. Whereas in this second diagram, you get to see the calculus builds up on the teeth. Hence, it irritates the gingival tissue. Therefore, they are red inflamed. So, the inflammation of gingiva is known as gingivitis. Itis stands for inflammation. So, periodontitis is the third diagram. Here, the inflammation caused to the gums separates the gums from the tooth. So, it irritates the gum to such an extent that they separate from the tooth, forming pockets. Also, early to moderate bone loss is seen in this condition. This is known as periodontitis. Peri means around, odontos means tooth. The structures present around the teeth like the gingiva, alveolar bone, cementum and pedial ligament. So, inflammation to this is known as periodontitis. In the fourth diagram, we see severe bone loss and very deep pockets. Hence, the tooth is in danger of falling off. So, plaque control is very important. So, what is plaque control? Regular removal of dental plaque, and prevention of its accumulation. There are two types, chemical and mechanical. We will be discussing about all this in detail. Mechanical plaque control, toothbrushes and dental According to ADA Council of Dental Therapeutics, the toothbrush is designed primarily to promote cleanliness of the teeth and the oral cavity. The main objective of toothbrush is to clean the teeth and interdental space of the food remnants, debris and stains, to prevent and disturb and remove the already formed plaque. Prevent the plaque formation and to disturb and remove already formed plaque. To stimulate and massage the gingival tissue and to clean the tongue. Parts of the toothbrush. This is the handle. It is a part of the toothbrush which is grasped in hand during brushing. Head is the working end of the toothbrush that holds the bristles. Shaft is this is the section that connects the head and the handle of the toothbrush. So this is a bristle and this is the tuft, which consists of a cluster of bristles. Brushing plane. This is the brushing plane. This is the surface formed by the free ends of the bristles. Types of the toothbrush. Based on size, they are divided into three types: small, medium and large, based on the size of the toothbrush. Based on the bristle diameter, they are divided into three types: soft, medium and hard. Soft 0.2 mm, medium 0.3 mm, hard 0.4 mm. Based on the type of the handle and the shank, they are divided into these four types: straight, angled, offset and angled offset. Based on the manipulation, they are divided into four types: manual toothbrushes, part toothbrushes, sonic and ultrasonic toothbrushes and ionic toothbrush. Starting with manual toothbrush. This is a manual toothbrush that most of us use. The ideal characteristics for a manual toothbrush are as follows. It should be easily and effectively manipulated, and it should be readily cleaned and aerated, and it should be durable. This bristle should not come out, and inexpensive. Also, it should be comfortable to the individual patient's requirements, and it should be designed for utility, efficiency and cleanliness. ADA specification of toothbrush. These ADA specifications of the toothbrush change from time to time. As of now, it is this. Brushing surface is 1 to 1.25 inches in length, 5 by 16 to 3 by 8 inches in width, 2 to 4 rows of bristles and 5 to 12 tufts per row. The main disadvantage of using this sort of toothbrush is dexterity. That means the user is only responsible for using any toothbrush more effectively. It depends on the brushing technique and the way the user uses it. Power toothbrush. They are also known as automatic, mechanical and electric toothbrushes. The first power toothbrush was designed to mimic the hand toothbrush technique, that is, using back and forth motion. Back and forth motion. Today, many types of power toothbrushes are designed for home use are available. Some with reciprocating bristle tufts and brushes that use low frequency. This is something that you need to remember. Low frequency energy to enhance cleaning ability. So, all power toothbrush rely on mechanical contact between the bristles and the tooth to remove plaque. Mechanical contact is very important. The head of this toothbrush oscillates in sideway motion or in rotatory motion. The frequency of oscillation is, however, around 40 Hz. Let me show it. See, sideward movement of the power toothbrush is seen in this diagram. Indication. It is used in case of young children and in case of handicapped patients. Advantages of using this type of toothbrush. It increases accessibility in interproximal and lingual tooth surfaces. Also, no specific brushing technique is required. User uses brushing force which is less than that of the toothbrush. So, these are the advantages. Sonic and ultrasonic toothbrush. This type of toothbrush produces high frequency vibration, which is 1.6 megahertz. Here it was 40 hertz. You know, did you note that? So it is this frequency is too high. Hence it leads to cavitations. So this is the disadvantage of using this type of toothbrush. However, this toothbrush helps in stain removal as well as in disruption of bacterial cell wall. This was an advantage of this type of toothbrush. It is this. Ionic toothbrush. Toothbrushes change the surface charge. Look, this is very much interesting. This toothbrush changes the surface charge of the tooth by an influx of positively charged ions. So the plaque with a similar charge, that means plaque with positive charge, is repelled from the tooth surface and is attached by the negatively charged bristles of the toothbrush. So this brush changes the surface charge of the tooth by influx of the positive ions. And because plaque has a similar charge, that means the positive charge, it is repelled from the tooth surface and is attached to the bristles of the toothbrush, which is negatively charged. Dentifrices. Dentifrice is a substance which is used along with the toothbrush for the purpose of removing dental plaque and debris and for applying specific agent to the tooth surface for prevention or therapeutic purpose. Dentifrice includes toothpaste, tooth powders, which are the agents which are used along with the toothbrush as said to clean and polish the tooth. So they are available in these four forms: powders, liquid, gels and paste form. We normally use paste forms. Composition of dentifrices. Abrasives, humectants, water, coloring agents, preservatives and binders. So what are abrasives? They aid in eliminating plaque and removing stains from the tooth surface. Humectants maintain the moisture of the toothpaste. Humectants maintain the moisture level of the toothpaste. Detergents, they produce a foam which aids in removal of the tooth debris. Flavoring agents leave a fresh taste in the mouth like mint flavors. Sweeteners are also added at times. Binders, they are very important. They control the stability and consistency of the toothpaste. Toothpaste, types of toothpaste. Number 1 is calculus control toothpaste or tartar control toothpaste. This is the composition of tartar control toothpaste. Use. This dentifrice benefits supragingival calculus removal. This is the gingiva. The calculus present above this gingival level is supragingival. This dentifrice benefits supragingival calculus removal. For example, Colgate tartar protection with whitening. Number 2, anti-caries or cavity protection toothpaste. So this fluoride helps in caries production, as the composition contains fluoride, sodium monofluorophosphate, right? So function. Fluoride stops the tooth enamel decalcification. We have already discussed that the caries is formed by demineralization of inorganic portion and dissolution of the organic portion. So this fluoride ion stops the enamel decalcification. Hence it prevents caries. Amount of fluoride which is present is between 800 to 1100 ppm. So protects the tooth from decays. For example, Colgate cavity protection. Number 3, plaque protection toothpaste. This is the composition. Function is it has antibacterial action and it prevents the formation of dental plaque. For example, Crest Pro Health clinical gum protection. Herbal and natural toothpaste. It consists of baking soda, aloe vera, strawberry extracts, but essential oils in this do not, however, contain fluorides or any of the chemicals. Number 4 is tooth whitening toothpaste. It consists of nascent oxygen, bleaching agent. So this is also used in case of tooth whitening purposes. Function of this toothpaste is mechanically remove food, smoke and other stains from the tooth. Example is Colgate Optical White, Colgate Pro Clinical White. Number 6, toothpaste, sensitivity toothpaste. This is the composition of sensitivity toothpaste. Function. It acts as a desensitizing agent. It relieves tooth sensitivity by closing the dentinal tubules. So this is the enamel and this is the dentin. And these are the dentinal tubules. So this particular toothpaste closes the dentinal tubules here. It closes the dentinal tubules, hence the sensitivity is not felt. Examples are Colgate Sensitive Sensodyne Thermoseal. Number 7, fresh breath toothpaste. It consists of peppermint, menthol, etc. Function. It enhances flavoring agents. It has antibacterial action to fight halitosis, means bad breath. It has antibacterial action. It kills the bacteria, hence it helps from bad breath. Example, Colgate Max Fresh. Function is to assist toothbrush in mechanically removing stains, debris and soft tissue deposits. It gives a polished surface to the tooth. It also acts as a mouth freshener. Brushing technique. According to the motion used, we have horizontal, vibratory, rotatory and vertical sweeping methods. And according to the methods, we have these all methods I'll be discussing in detail. Starting with Bass method or sulcus cleaning method. Indications of Bass method are for open interproximal areas and for cleaning of areas directly beneath the gingival margin. Advantage. It is effective method for removing plaque. It provides good gingival stimulation and it is easy to learn. However, it is time consuming and might cause injury to gingival margin. Brushing technique. You need to place the bristles of the toothbrush along the gum line at 45-degree angulation, as you see in this diagram. Now the bristles should contact both the tooth surface and the gum line. At a time, 3 teeth are selected. The brush is placed along the 3 teeth and 3 teeth are brushed at a time. So we use vibratory back and forth rotatory motion while we brush our teeth, and then we move to the next set of teeth. These 3 steps are common for all the brushing techniques. So here the brush is tilted vertically behind the front teeth, and we make several up-down strokes using the front half of the toothbrush. Now the brush is placed against the biting surface of the teeth, and gentle back and forth scrubbing motion is used to remove the plaque on the occlusal surface, that means on the biting surface. Modified Bass technique. It is used as routine oral hygiene method for interproximal cleaning. These are the interproximal areas, the area present between the teeth. And in areas with progressive gingival recession, supposingly this is the teeth and this is the level wherein the gingiva should be present. And if the gingiva is resided to this level, we say that gingival recession has occurred. So, this modified Bass technique is used in case of progressive gingival recession. Technique. We follow all the steps of Bass technique, and after vibratory motion has been completed in each area, swipe the bristles over the crown of the tooth towards the biting surface. This is the biting surface. Swipe the bristles towards the crown of the tooth towards the biting surface. So in this diagram you can see after brushing, vibratory back and forth motion. After doing that in this area, we just move the brush towards the biting surface so as to remove the dirt from the tooth. Importance of this method. It cleans cervical 1/3 and beneath gingival margin. It helps in periodontal maintenance and is suitable for everyone. So, this technique is more recommended for everybody. Advantages of using this method: it gives excellent sulcus cleaning and good interproximal and gingival cleaning and good gingival stimulation. Only disadvantage is dexterity. That means the ability to perform difficult tasks skillfully and quickly with hand. It's time taking. Chadda's method. Indication: it is used by those individuals who wear partial denture or orthodontic appliances, like in this diagram. The patient undergoing periodontal surgery. For this, soft to medium tufted toothbrush is indicated. Technique: the position of the bristle is towards the occlusal surface of the tooth, as you see in this diagram. Towards the occlusal surface of the tooth. This is the occlusal surface. Place the sides of the filaments against the enamel and the angle them at 45-degree angle to the tooth surface. As you see in this diagram, 45-degree angulation should be angulated at 45 degrees. Vibrate the bristles gently but firmly, keeping the bristles against the tooth in the interproximal areas. Now reposition it on the next set of teeth. Advantage of using this method: it massages and stimulates the gingiva. However, it is a poor removal of supragingival bacterial accumulation and has a limited brush placement. Also, it requires high dexterity. Stillman's technique. It is indicated in case of gingival recessions and plaque removal from cervical area of the tooth. This is the cervical area. Technique: like Bass method, the filaments are placed at 45-degree angle to the tooth, as you see in this diagram, and the bristles are placed half in the sulcus and half on the gingiva. Now the bristles are activated by short vibratory back and forth motion and simultaneously moved in the coronal direction. Back and forth motion and moved in the coronal direction. Coronal direction towards the crown. This is the crown. Modified Stillman's technique is indicated for dental plaque removal and cleaning tooth surface and gingival massaging. Disadvantage is it is time consuming and it causes damage to epithelial attachment. Scrub method. It is indications are for young children to get the feeling of brushing. Technique. This method of brushing requires vigorous horizontal, vertical and circulatory motion. That means it's a free style of brushing. You brush the way you wish. So the disadvantage of using this method: it is not effective in plaque control. Also, it causes tooth abrasion and gingival recession. So the tooth is supposed to be like this and now it has abraded. This is what is called abrasion. It is caused due to faulty tooth brushing technique, like scrub technique. So this is the method. You scrub any way you wish. Phones method. It is indicated for school children and for physically and emotionally handicapped individuals. In this technique, the child is asked to stretch his arms in such a way that they are parallel to the floor. And now the child is asked to make big circles using the whole arm to draw the circles in the air. The circles are reduced in diameter until very small circles are made in front of the mouth. Now the child is ready to make circles on the teeth with the toothbrush, making sure that the teeth and gums are covered. This is the technique. Advantage: it is easy to learn and short time consuming. But the disadvantages are possible trauma to the gingiva and interdental areas are not properly cleaned. That means these areas between the teeth are not properly cleaned. Interdental areas. Roll method. Indication: patient requiring gingival massage and stimulation, and for children and adult patient with limited dexterity. Technique: Direct the bristles towards the root of the crown. Now place the side of the brush on the gingiva and have the plastic part of the brush even with the tooth. You see here. It's positioned towards the root. Now press the bristle against the gingiva as you see. It's pressing the bristle against the gingiva and roll the brush over the teeth. Roll the brush over the teeth. So this is the method. Smith method indication for supragingival cleaning. Technique. Bristles are pointed incisally or occlusally and then moved along and over the tooth surface and gingiva. Motion is gentle sweeping from the incisal or occlusal surface over the facial surface and progressing towards and over the gingiva, as you see in this diagram. Advantage of using this method is natural self-cleaning mechanism. Also, supragingival cleaning is good. Disadvantage of this method is interdental spaces and sulcuses are not properly cleaned. Leonard method. In this method, we use a vertical stroke in which maxilla and mandible are brushed separately. Technique. The bristles of the toothbrush are placed at 90-degree angle to the facial surface of the teeth, as you see in this diagram. This is the facial surface. The bristles are placed at 90 degrees of the tooth surface. With the teeth edge to edge, place the brush with the filaments against the teeth at right angles to the long axis of the teeth and brush vigorously without great pressure. With a stroke that is almost up and down on the tooth surface with just a slight rotatory or circulatory motion, maybe like this. After striking the gingival margin with force. So in this technique, enough pressure is used. It is not intended that the upper and lower teeth shall be brushed in the same series of the strokes. The teeth are placed edge to edge to keep the brush slipping over the occlusal and incisal surfaces. Advantage of this method is it is more convenient and effective for small children with deciduous teeth. Disadvantage is definitely interdental spaces of the permanent teeth of adults are not properly cleaned. So this is the summary of our discussion. Angle of placement is 45 degrees for these four techniques, and the motion used as we discussed, back and forth motion and all. In modified pass technique, we do all this and then we sweep occlusally towards the biting plane. Again, modified Stillman's horizontal scrub phones technique. This is the summary of our discussion. Interdental cleaning aids. They are addictive devices. These are addictive devices which are used to remove plaque from the interdental tooth surfaces. That means interdental areas. Factors affecting in selecting interdental aids are type of gingival embrasure, alignment of teeth and contact areas. Starting with dental floss. Dental floss is a type of cleaning aid. It's of following forms: multi-filament, twisted or non-twisted, bonded or non-bonded, thick or thin, waxed or non-waxed. Technique of using dental floss. We have two techniques. In both the techniques, 12 to 18 inches long piece of floss is taken. But in this case, in this technique, circle or loop method, this 12 to 18 inches long floss is tied securely at the ends with the three knots. Now all the fingers except the thumb of both the hands are placed within the loop as you see in this diagram. Except the thumb, all the fingers are placed within the loop. And the floss is held tightly by both the hands, having 1 to 2 inches of floss in between the fingers. It is this. And this floss is passed between the teeth and plaque is removed. Slope method. About 12 to 18 inches long floss is taken, even in this case, and about 4 inches from each end is wound to around the middle finger of each hand. In both the hands, at least 3 fingers are folded. The last 3 fingers are folded and closed, and both the hands are moved apart. In this way, about 1 to 2 inches of floss is held tightly between the index finger of both the hands. And this floss is passed gently through each contact area with back and forth motion. So this was done even in case of the circle or loop method. See, 1 to 2 inches is held between the index finger, which is passed between the contact areas to remove the plaque which is accumulated by using back and forth motion. Interproximal or interdental cleaning brushes. They are used for interdental cleaning. Types: single or uni-tufted brush, small or conical brush. Small conical brushes. Techniques: interdental brush of any style are inserted through the interproximal spaces and moved back and forth between the teeth with short strokes to remove the plaque. Wooden tips. It is a soft, elongated, triangular shape balsam wood which is used in cleaning interproximal areas. It stimulates the papillary gingiva, that means this, gingival papilla, as well as it removes the plaque. Technique: they are placed in the interdental space as you see in this diagram in such a way that the base of the triangle rests on the gingiva and the sides are in contact with the proximal tooth surfaces, and it is moved in and out of the embouchure, removing soft deposits from the teeth and also mechanically. Indications: it is indicated when there is missing interdental gingiva or where there is reduced interdental papilla. Disadvantage of using this method: it may cause opening of the embouchure. Also, the wooden ends may cause tissue trauma. Gingival massage. Massaging the gingiva can be performed with a toothbrush or rubber tip. It produces epithelial thickening. Gingival massage produces epithelial thickening. It increases keratinization and increased mitotic activity by epithelium and connective tissue. It provides plaque control. Let's see how. See, this is it. It stimulates the gingiva and also it helps in removing the plaque. Water irrigating device. It is beneficial in removal of unattached plaque and debris. So this device is composed of a built-in pump and a reservoir which is used to deliver antimicrobial agents. Tongue scrapers. The process of removing debris from the surface of the tongue with some form of scraper is called tongue scraping. So the tongue scrapers are made up of plastic or metal. Also, sometimes soft toothbrush can be used. So these are plastic tongue scrapers and this is the metal one. Chemical plaque control, which includes antibiotics, enzymes, bisbigbonides, quaternary ammonium components, phenolic components, fluorides, oxygenating agents, natural products, and other antiseptics. Bisbiguanides. They bind to anionic acid groups on salivary glycoproteins, thus reduce the plaque formation. And it also reduces the gingival inflammation. Metallic salts. They have inhibitory effect on plaque control. Number 3. Antibiotics. They are used as anti-plaque agents in hospitalized patients. Phenols has antibacterial action which depends on the ability to penetrate the lipid components of the cell walls. Enzyme penetration. Enzymes capable of breaking down of matrix of already formed plaque. It breaks down the matrix of already formed plaque were considered for inhibition of plaque formation. Quaternary ammonium components. These are cationic antiseptic. They are cationic antiseptic and surface active charge which react with negatively charged cell membrane phosphates and cell wall structure of microbes is disturbed. Hence it kills the microbes. Chlorhexidine. Chlorhexidine, it is a gold standard in chemical plaque control with outstanding bactericidal and bacteriostatic property. So chlorhexidine we'll be discussing in great detail. It belongs to this group, chlorhexidine. It is effective against both gram-positive and gram-negative organisms. However, it is more effective against gram-positive organisms. It's available in digluconates, acetates, and hydrochloride salts. What makes chlorhexidine unique? It is long-lasting bacteriostatic action. That means it lasts for 12 hours in oral cavity. Also, it has pin cushion effects. That means it attaches to the pellicle by one cation to the bacteria, attempting to colonize the tooth surface with others. Uses. It is used as an adjuvant to oral hygiene. It is used in post-surgery cases and used in patients with intermaxillary fixation, for oral and gingival hygiene, for mentally compromised individuals, patients with high caries rate, recurrent oral ulcerations, and for FPDs and RPDs, and treatment of denture stomatitis. Adverse effects. When any of the mouthwash is used for a long time, it gives certain adverse effects. And this chlorhexidine mouthwash, if used for a long time, these are the side effects that we get to see. Number 1. Extrinsic stains, alteration of taste, oral mucosal erosion, enhances supragingival calculus formation, parotid gland swelling, and in case of overdose, it leads to nausea-like symptoms. Dosage. 15 ml of undiluted chlorhexidine is diluted with equal amount of the water and is used twice daily for 30 seconds. This is something that you need to remember. Note: not to rinse with water or eat or brush for 30 minutes of chlorhexidine use. Products: mouth rinses, gels, sprays, toothpaste, varnishes, chewing gums, perio dressings, and supragingival plaque control like perio chips. Mechanism of action. it has two actions. Number one is antimicrobial, which shows different effects at different concentration. That means it is bacteriostatic at lower concentration and bactericidal at higher concentration. So this cationic chlorhexidine molecule, when acts on negatively charged bacterial cell wall, it is instantly absorbed to phosphate containing components. Then the chlorhexidine binds with phospholipids of inner cell membrane, which causes loss of the cell wall integrity. This leads to leakage of lesser molecular weight components like vitamin K. And then intracellular coagulation occurs, which slows down the leakage of intracellular components. And then cytoplasmic coagulation happens. This leads to irreversible cell damage. This is the second action of chlorhexidine, anti-plaque action. This happens by three mechanisms. Number one, effective blocking of acidic group of salivary glycoprotein leads to decreased absorption to hydroxyapatite formation of acquired pellicle. Hence, it decreases plaque formation. Number two, absorption of chlorhexidine to extracellular polysaccharides of bacterial capsule lead to decreased bacterial ability to bind to the tooth surface. Number three, chlorhexidine may compete with calcium ions for acidic agglutination factors in plaque, hence prevents the plaque formation. Conclusion: there are several acceptable toothbrushing methods because each patient has different needs. The important thing here is to brush at least for 2 minutes each time and twice a day. Be true to your teeth or they will be false to you. Thank you.